My knees have been bad for years. Must be at least 20 years ago, I had a partial done. That was helpful for a while, but that wore off. I was scheduled for a knee replacement surgery. I got the first knee done last year. It was a tough recovery. I mean, you get pain meds for maybe a week or two, as I recall, and then you're on Tylenol only. I do chair yoga and I do another senior exercise class, so I was not able to do that for 6 months. I still remember it being as quite painful. I'm looking forward to it being a lot easier this time, hopefully.
One day I was talking to Dr. Harvey, and he was telling me that he can do this new procedure where it's less dependence on opiates and everything, where he actually blocks the nerve for an extended period of time instead of like a traditional nerve block where it usually lasts like 2 to 24 hours. He was able to offer a nerve block using a treatment to freeze the nerve where it lasts upward of 3 months. It seems new and innovative. It seems like a good adjunct. There's been research studies on it. This may be one of the few places it's done in the Western New York area, but it's definitely being done across the country.
Well, since my knee surgery has been postponed to September, I decided to give this procedure a try now to get me through till I do have the knee surgery and then have it once again 2 weeks before I do that. I'm hoping to, walk and be very active after this. We'll see.
And Kim, you all right?
Yeah,
How's that feel?
it doesn't. There's no pain there.
Your pain is a 0 out of 10?
A half. The knee pain was definitely alleviated after I call it my trial procedure. It pretty much not eliminated, but reduced the pain for months afterwards, so I could, function better and go back to my daily exercise and all of that. So I'm looking forward to getting this next knee done a little bit more pain-free.
I think she's more mobile. Her mobility's improved. She seems to obviously have pain relief, which is good. She's had improved sleeping.
Dr. Harvey's very nice to work with, very calm, very reassuring, tells you what's going to happen when. Plus he explains as he goes along, so there's no surprises. He's going to be my anesthesiologist also, for the knee procedure, so I'm looking forward to that.
I'm hoping this go around with this new knee surgery, she will have a faster recuperation, able to meet those benchmarks and milestones that are so important in physical therapy earlier, and that just being due to obviously the pain control and management.
Well, from the experience I've had so far, prior to having my knee done, I would definitely recommend it. Even if you're not having surgery and you're in a lot of pain, I would recommend it just for that. I mean, I will know better after the surgery to see how it differs from the previous one, but I expect it to be hopefully much easier and get right into the physical therapy part quicker. Getting the second knee done will, I'm sure, change my life. And this procedure here will hopefully help me get through it.